it was actually a very intense and very exciting first day. It's always great to meet so many colleagues, so many friends from all over the world, and kind of to get face to face with them and to kind of discuss everything. So from the beginning, it was actually really intense. This early morning, we had a IV thrombolysis section. And on that section, we actually had the results from the IRIS collaboration. And we also had some results from the Mesoclean trial, which was actually perfect. So we can get some kind of an insight and high quality data on how do IV thrombolytics compare to mechanical thrombectomy. And then afterwards, we actually had an opening session. And we had a lot of randomized results from the randomized control trials and the late-breaking trials. And of course, there was the timeless trial, which investigated the effects of the Tenecteplase in the late time window. There was the ELAN trial, which was also published, if I'm not mistaken, just a few hours ago in the New England Journal of Medicine. And the ELAN trial was comparing early versus late anticoagulants in stroke patients with atrial fibrillation. There was the ARCADIA trial, which tested Apixaban versus aspirin prevent recurrent stroke strategies. And there was this trial from Germany, which was comparing structured ambulatory post-care programs. These trials are really great because they're providing high-quality evidence, and they're really giving us insight into stroke treatment and stroke therapies. But what kind of stuck out with me the most was one trial which was actually not a treatment trial, but it was actually a stroke rehabilitation trial. And this was the RESTORE trial, which was done by the investigators in India. And they were comparing adjuvant stroke therapy versus regular physical therapy for stroke rehabilitation. And I think it's really great that ESO is also, and that generally the stroke community is recognizing the values of these rehabilitation trials, because interventions are great, absolutely. And we have a lot of results from these, and it's really improving stroke care. But an important step in stroke care, in comprehensive stroke care, is also the rehabilitation. So I think it's really great that you're also highlighting the rehabilitation trials, and I think it's also good that you're investing resources into that, because I think that's the next question, and it's something we should focus on. And right now it's just, full chaos. There are several parallel sessions going on, so you kind of have to make a bittersweet decisions what you want to attend, but you cannot. But I think if you skip something, you can always later on, because they're all pre-recorded, so you can just later on look it up online. But it's been going on really great so far, and I'm looking excited for the rest of the day and the moderated poster sessions. I think those are going to be really exciting.